In the past, people were always worried about children getting chickenpox because, in addition to the unbearable symptoms, it could also leave scars. However, not only children, but also adults can get chickenpox, even if they have been vaccinated. So, what is chickenpox? Chickenpox is an acute infectious disease caused by the varicella-zoster virus, which occurs mainly in children under 12 years of age. Although almost everyone is immune to chickenpox for life, the virus can remain latent in the body and recur years later, causing shingles, commonly known as the snake. The first symptoms of chickenpox include mild fever, fatigue, loss of appetite, headache, and muscle or joint soreness. After about 2 to 5 days, a red rash appears on the body, which then spreads to the face and extremities. These rashes become flat, then small, raised bean-shaped blisters that last about 3 to 4 days before drying and crusting over. The rash usually clears up within 2 to 4 weeks. The incubation period for chickenpox is 10 to 21 days, with the onset of the disease usually peaking 14 to 16 days after exposure. Chickenpox can be spread by droplet or airborne transmission, as well as by direct or indirect contact with a person's chickenpox or shingles, blister fluid or mucous membrane secretions carrying the pathogen. The infectious period begins 1 to 2 days before the rash breaks out and lasts until all the small blisters have crusted over. Especially at the beginning of the rash, chickenpox is highly contagious and can be spread to people who have not yet developed the disease. The infectious period is not over until all lesions have scabbed over. Some complications may occur when patients get chickenpox, such as secondary bacterial infections, e.g., cellulitis, necrotizing fasciitis, sepsis, toxic shock symptoms, pneumonia, encephalitis, cerebellar ataxia, Reye's syndrome, skin inflammation, meningitis, etc. Therefore, when patients get chickenpox, it is very important for them to be aware of the risk of developing the disease. Therefore, when suffering from chickenpox, patients need to pay attention to a number of things, such as adequate hydration, adequate protein intake to strengthen the immune system, avoiding barbecue, fried and spicy foods, and eating less fermented foods. If the itching is unbearable, you can ask your doctor for a suitable anti-itch medication. Chickenpox can be treated by focusing on the symptoms, such as fever reducers for fever, pain creams for pain, and anti-itch medication for itching. In addition, patients need to keep clean and change their clothes and bed linens regularly to avoid secondary bacterial infections. In case of serious complications, immediate medical attention is required. The most effective way to prevent chickenpox is to get vaccinated against it. According to the World Health Organization, all people who have not had chickenpox should be vaccinated against the disease. The varicella vaccine is effective in preventing chickenpox and minimizing complications. Secondary bacterial infections can also be avoided by avoiding contact with people who have had chickenpox and by practicing good personal hygiene. Besides chickenpox, there are many other diseases that can be prevented by vaccination, such as measles, mumps, German measles, and whooping cough. Therefore, it is recommended that you get vaccinated regularly to protect yourself and others. In conclusion, chickenpox is a very common infectious disease, but it can be effectively prevented and controlled by vaccination and good personal hygiene. If chickenpox occurs, timely medical treatment can also minimize the occurrence of complications. We hope you can learn more about chickenpox and protect yourself and those around you.